Hi. So, what do you think about this conversation?
Well, I mean, obviously,
You're Amanda's doctor to be.
Yes, and
Okay.
I'm Barb's doctor as well.
Okay.
And I would recommend if you're going to have anything done, do the least amount necessary to make you happy, and then stop. You know, and I would support her because I'm her parent. But obviously, nobody wants their child to have work done. And if they do want them for, no reason, then obviously there's an issue. But when it really comes down to small procedures that can make big improvements in life, they're an adult. They can make that decision.
How common is it for moms to be buying this for their daughters?
It's more common than we would expect. And I don't think it's so much that moms are forcing it on their daughters, but a lot of times it's financial. And we see women who are in their 20s who just aren't quite ready to make that financial commitment, and their parents help them out.
And are the majority of people that come to you mothers that want to kind of get their look back, get their youth back, the baby weight, etc.?
Yeah, and I think there's a difference between responsible plastic surgery, where we're trying to get you back to where you used to be, versus trying to make you into a Barbie doll or Jessica Rabbit. There's a big difference there. And as a responsible plastic surgeon, I want my patients to look as absolutely natural as possible and to be happy.
I have a question.
It's a way
I have a question for the doctor.
Do you think that Frances has had too much work?
In my opinion,
yes.
Yeah, I do. But if she's happy with herself, who am I to judge her?
You do?
It's not my
think
decision.
I had too much work? Oh, look at this body. I've been walking billboard for my husband, so I have to, like...
If she's happy with herself, who are we to judge people? She's not hurting anybody by looking the way she does.
Well, do you stop? Do you say no? Do you say, no, I'm not doing it? Do you
I turn down 1 out of every 5 patients that come to see me.
Bethenny, okay. I have a question. I have a question for the doctor.
Okay.
I was telling her that, in waiting till after you're done having children, they were trying to disagree on the fact that having children will not affect the breast implants and how they might look afterwards. Do you agree with them?
So when I see patients...
pregnancy can affect the way that they look, correct?
So whenever I see patients who say, I'm thinking about having kids in the future, I always tell them the best time to have plastic surgery is after you've had kids. There's no question about that.
Okay.
However, she's 21. This is something that she's an adult. Whenever I have patients who are I don't operate on anybody under 18.
Okay.
In this situation, if she's not going to have kids for another 10 or 15 years, should she wait?
Then, okay. All right. Thank you. We could talk about this all week. Thank you, Dr. Youn. Thank you, Frances, Shay, Barbara, and Amanda. When we come back,